This is Dr. Claudine Roura, the Fat Sucker, and welcome to my channel. Now, I'm going to discuss a new treatment, the ROURA VTIGHT. The ROURA VTIGHT. What is VTIGHT and how did I call it VTIGHT? V stands for tight. Okay, and tightening, of course, tightening. So it's vaginal tightening, or what we call laser vaginal rejuvenation. Now, in this procedure, which is actually happening back there, is actually a non-invasive, non-ablative form of vaginal tightening. When you go to the OBGYN, they would do, flower arrangement. But normally, they do a surgical kind. Okay, so they cut a piece of tissue, they tighten, they stitch, and then it tightens surgically. Now, with that procedure, if you just gave birth, okay, it's called an episiotomy, no? Kung nasira siya during birth, and then they're gonna be tightening it, cutting tissues, and tightening up with sutures. So, however, after that, as years go by and as you have more children, the vaginal bulb becomes loose. Also, the labia majora, labia minora, everything ages. So this is actually made for the aging vagina. So it's not just for the vagina inside or outside. It is also intended to improve, to increase or to tone up, the pelvic floor. When you have actually some form of incontinence due to childbirth, so the heat administered from the laser will actually help tone up all of these muscles and all of this tissue. Okay, so how does it actually work? Okay, so it's actually not really very new. It's been here for I think more than over 10 years already. It's not just very popular. The thing is, there are several kinds of it. You have laser vaginal rejuvenation. You use lasers. Okay, there are several things that you can actually do. There is the CO2 lasers and the YAG lasers. Now, these are what you call the ablative lasers. Okay, you have a probe, you insert into the vagina, they emit laser heat that epithelializes the vagina. So, may konti siyang wound doon, just like the skin when you do these lasers. You injure the skin so that after a while, when the skin recovers or when the vagina recovers, it is younger and plumper and you develop more tissues. Okay, so that's the same. These are the ablative ones. You also have the non-ablative ones, yung walang sunog. Okay, now this is actually used with other heat. Okay, heat modalities is used for this one. You can have either RF, which is usually it's the thermiva. Okay, you put in control the heat into the temperature into the four walls of the vagina, and then the heat will actually literally shrink the vagina and other tissues around it. It shrinks to the point of hindi naman siya sunog. It's not burn. It's more of like moderate skin contraction, moderate tissue contraction. Okay, so you can have your RF, which is your thermiva. You can also have this actually our new kind of laser, which is your diode laser. Later I will show you the probe and how it will actually work. This one gives off a circular form of heat. No, it's a radial heat that heats up moderately the tissues around it and stimulating skin contraction, collagen contraction, tissue renewal. Okay, so basically it's heat. I always refer to it like bacon. So, when bacon is raw, okay, mahaba siya, no? It's very fluffy. But when you actually cook bacon, it actually shrinks in any other meaty tissues in that case, no? It's more of shrinkage with the heat. So, what do you get out of the procedure? You get a tighter vagina, you get a firmer labia, and at the same time, it gets rejuvenated. You get wetter, and then you get more sensitivity from the clitoral area, and at the same time, if you have issues with incontinence, and then this is actually the perfect solution. It's actually just around 5 to 10 minutes procedure, 10 to 15 for including the outer vagina, including the outer labia minora and labia majora, and it's done once a month for 3 sessions. And then there you go. You'll see it actually immediately. Thank you. Okay, this is our client. Okay, she is actually having her second second treatment.
Second session.
Okay, so how does the treatment feel?
This is amazing, Doc. You know, it's like my husband is making love with me right now. Yeah, this is so amazing that the ladies should not be afraid of doing this. I had lots of benefits, you know, my incontinence, and my husband said, oh, so tight. So yeah, everybody happy. So I really endorse this kind of treatment. It's only 10 to 15 minutes and voila.
Yeah.
So please,
no downtime.
get this treatment, and your husband or your partner will not look for another. Okay. Yeah.
Sure.
Thank you, Doc.
Thank you very much. Josh, you're still doing the procedure right now and it's very comfortable. How does it feel? Medyo warm lang?
Just warm. It's like your husband or your partner is making love with you.
Alright.
That's the way I describe it.
Okay, perfect.
Yeah.
Thank you.
Love it.
Hello. Now I'm going to show you the actual machine that we use for the ROURA VTIGHT. Okay? Basically, this is the tube that we actually insert into the vagina, and if you take a look at this, look at that ring. Okay, there is actually a circular form of light. Okay, so the light, a laser, emits heat through this light and is conducted into the glass tube. Okay, so the glass tube becomes warm into the area where you have your radial fibers. Okay, so the radial, so it's actually a 360 heating of the vaginal canal. So the movement is actually a to and fro movement. Okay, so that you can actually distribute equal heat throughout the vaginal canal, and actually this is the heat that will tighten and rejuvenate the vaginal canal. That's why it is called your V-lift. Okay, it's a very comfortable treatment. There's a little bit of a warmth feeling, and it's actually a very pleasurable and enjoyable treatment. Okay, so this is actually our laser. This is your diode laser emitting your radial laser fiber into your vaginal tightening. Okay, so this is it. So don't be scared. It's non-surgical. It's non-ablative. So there is no wound after. Okay, so immediately after, there is no downtime. It's non-surgical, non-ablative, and you just have this very soft, very smooth, and it's a very light treatment. Okay, no cutting. Thank you. To watch more videos, like and subscribe to the Fat Sucker channel. And again, this is the Fat Sucker, Dr. Claudine Roura, saying see you in our next episode. Bye-bye.